But then I also realized, man, chiropractors and PTs, there's a lot of similarities and I learned a lot from them. But there was a lot of big difference. One, our focus on the spine. We can rehab knees, ankles, joints, all sorts of things. But people come in for spine pain.
Yeah.
And it led to unique protocols I was developing and how we integrate that with what chiropractors do, which is where do you fit this in with the adjustment? And then how do we integrate functional rehab in a real way that patients are compliant and it's fun to do? And how do you charge for all this? I mean, all these things. And I found myself developing these kind of protocols. Well, I didn't think I was doing anything special. I just was, just like everybody else, you're in your practice, you're focused in. But then COVID hit. And I found myself with a lot of time on my hands. And I went into my office and I just said, I'm going to create a curriculum. I don't care if anybody ever even shows up. I need to get this on paper. Even if nothing else, I send it to my friends and it helps them. And I created a class. And then we had 10 people in our first class. I said, well, this is kind of fun. And my other classmates that were in Texas called me and they said, would you come and do this for us? I'm like, I don't even know if I can, and then we did that. We went to Austin and then Austin led to Dallas and Dallas led to Houston. And we started just going and I started booking classes and helping chiropractors. Really, I take them through the evolution that I had, which was one, here's this thing. It's called dry needling and it helps people get relief really fast. It's really effective. It doesn't cost a lot to administer. And also, here's how you integrate that into a multimodal therapy regimen or care plan so that you get these people not just out of pain, but then into doing functional rehab so they can get back to doing the things in life that pain was keeping them from doing. And how do you think about that? And how do we also get quick? Because we got to start getting faster. If you notice, man, I don't even want to go get my own groceries. I don't want everything. Going to an office 3 times a week and spending an hour there, it's not in the zeitgeist anymore, right? The patience for people. So I said, look, we got to get fast and we got to get real effective real fast. And that means getting people out of pain and back to their life faster, where they could be in and out of your office in under 30 minutes and get that relief that they're looking for. None of this, well, you have to wait and see and how it's going to take time to work. That doesn't cut it anymore. People are instant gratification people. So I teach my students how to, quickly assess what is the problem that we're dealing with. They come in with this pain. What's the function that's causing the pain, the dysfunction? How do we address that with the needle? Maybe use the needle as even a diagnostic tool to see what structure is causing the pain. And then what do we do with that increase in pain-free function that we get right away? Where do we integrate the adjustment? And then how do we integrate basic exercises? I keep seeing these exercises on social media where people look like they're auditioning for Cirque du Soleil. And I'm like, I don't know what patient population you're dealing with, but I need people need basic rehab. They can only handle maybe 1 or 2 exercises a week that they can integrate into their lives. And so how do we simplify this? How do we get it low cost so our new docs don't have to go spend a bunch of money to get real effective, real fast and be competitive? And how do you integrate it into a chiropractic, low overhead situation? So that's what I teach. I also help my patients integrate this into personal injury, which is just a great tool for it. And to start rethinking about chiropractic is not just a delivery of adjustments, but rather a delivery of physical medicine, pain management. And I want us to start competing on that level, be on the level of, real problems that people come in with that they could Google. They're like, yeah, I have that. And those people have choices. Usually it's pain management, some other stuff they don't want to do. And I wouldn't want them to do either. But now you can start helping address these conditions with dry needling and be at that level rather than just being another doc in another box that's just delivering adjustments. So it puts them at a different level. And that's what I'm trying to get out there to do for these docs.
Thanks so much for checking out that interview. If you liked it, we have plenty more available. You can check out the next interview right here.